One of the most common questions I have in clinic is, how can I maximize my outcome and make sure I'm appropriately prepared for surgery? I often talk to patients about making sure they're optimized for a joint replacement. That typically includes making sure you've failed everything besides surgery first. Making sure you've tried medications, rest, activity modification, and you've also optimized yourself medically for an elective procedure of this magnitude. That includes making sure you've worked on losing weight if you can, and that's often in collaboration with a weight loss specialist or your primary care provider. Making sure any of your primary medical conditions are optimized. So make sure if you're diabetic, your hemoglobin A1C is well controlled. Make sure that you're not smoking. Make sure that you're cutting down on your drinking and that you have optimized yourself for a procedure like this. Patients want the best outcome possible, and that's something that I strive to provide for them. And one way to make sure that that happens is to make sure that you've taken care of all the things that you can take care of on your end first.